My name is Ken Lemler. I've been here at Methodist for 26 years. I've been a transplant coordinator, it's clinical lung transplant coordinator for about 6 years now.
It's Ken from lung transplant. Hey.
My job is to take the pre-patients, lung transplant patients, from day one. They'll get a referral, they'll come here. As soon as they get here, of course, these folks, a lot of times it's their first understanding that they might need a transplant, so they're scared to death. Part of my job is to really try to make them feel at ease, because when you get here, especially small town USA, these folks come from out in the middle of nowhere. You come to Methodist, it's kind of a big deal, and I need a transplant suddenly, scare the heck out of you, you know. You'll get a 6-minute walk today.
I did.
They've already done the...
I rocked it.
Good, of course you did. Once I get approval from insurance and everything looks good, the doc said, yes, let's move forward. Then I reach out to the patient and their family. We schedule them. It's 3 days of outpatient testing. That's really the substance of us assessing you to decide if you're a candidate. And then once we get that testing done, then we all meet we have a multidisciplinary meeting that we meet on Thursday mornings to evaluate these folks. So we put all the testing together, we have the entire team together, and we go through every aspect of their evaluation. That's the other awesome thing about this job, is it's not just one person, because I have this one little job, which is a lot, but we've got this other team that you're coming here not just to get a transplant. You are coming here for the package deal. I tell them that we're like a symphony. It's like everybody, we've got so many moving parts, and we all come together, and it's just a beautiful thing.
We'll be taking those 2 items off of your to-do list when you come for your 3-day testing.
Calling folks is kind of a joy. In fact, I'll call them, and depending on when it is, or sometimes I've got to call them on Christmas Day or something, and it's like, hey, what do you think about new set of lungs for Christmas or whatever, and they're just, of course they're crying and freaking out. I build a pretty close relationship. We always do with those pre-patients, and I follow them in the morning, before they get transplanted, and then also post-transplant. They see all these faces. The one constant for them, pre and post-transplant, is their coordinator. Their coordinator is the one, that's my patient. They are always going to be my patient. Even after transplant, I'm going to go and visit them when they come back to visit in clinic, and it just brightens their day, and it brightens my day to see them thriving. I look at these folks, it's like, I see in their eyes the fear of what they're going through. And if you weren't, I'd be worried that you didn't have a little bit of concern, because this is a big deal. It's a life-changing situation, and it's a forever thing too, So I love what I do.